Hello, Bitterroot Health employees. I'm Pete Dunn, Regional Director of Bitterroot Health, and we're excited today to give you a tour of the new Stevensville clinic.
Hi, I'm Emily Holznagel. I'm the clinic supervisor here at the Bitterroot Health Stevensville Clinic.
A few fun facts for this clinic. It's actually 21,000 square feet. We're excited to offer a lot of services from primary care, urgent care, specialty care services, which include urology, orthopedics, OB, and a few others. We'll have lab to support that, as well as imaging services. On the other side of the clinic, we actually have rehab for physical, occupational, and speech therapy, and an awesome leadership team to be a part of the clinic. So we want to take you through the clinic space by space and kind of show you how awesome this space is and how lucky we are to work here. Something that I love about this clinic, right when a patient walks in to the vestibule, right through the sliding doors, they get to see this mural. It says Stevensville, where Montana began. Stevensville is an awesome town. It has a lot of history, you know, from the creamery days to the first hospital to Fort Owen Inn, St. Mary's Mission, you name it. So our marketing team actually put together an amazing mural and put that up here, and I think it really says a lot about Stevensville and what we're part of. As our clients walk in, several patients will need wheelchair accessibility and access to wheelchairs. Blue Star Fabrication here in the Bitter Valley made an awesome setup here for us to store the wheelchairs in.
Welcome to the Galleria. This is our patient access representative team here. They're ready to check you in. We have our central greeter. She can help direct patients to where they need to go so they don't feel lost in such a large space. In our central waiting room, patients can feel free to wait wherever they would like. They can enjoy our fireplace, or they can be by the large windows close to their imaging location or the primary and urgent care pods. So
this is our imaging hallway, and down this hallway we have ultrasound, x-ray, DEXA, mammo, and CT, so we're very excited to offer that.
This is our centrally located urgent care and primary care pod. 10 exam rooms surround the pod. We have the care team in the middle so that it facilitates real-time communication amongst the team. Our exam rooms were designed to be patient-centric. We bring all of the services to the patients in one location.
In all of our exam rooms, they're set up the same. It was a fun process during the design phase. We had input from the providers, from nursing staff, and several leaders as it relates to what do we want to provide to the patient when they come into the exam room. And so you'll see the integrated wall mount with the computer system. When the patient's sitting here at the exam table, the provider can be standing or sitting on the integrated wall mount, and we can actually have that conversation with the patient, show them information on the computer if we want to, whether it be vitals or x-rays, and have that eye-to-eye conversation. So again, very patient-centric.
In our standardized exam rooms, we have our mobile exam cart as well as our specialty carts. So we can bring in the necessary equipment for that procedure. We don't have to have too much equipment in one room. That will help cut down on wasted materials as well as overstocking rooms.
So we're now halfway through the clinic. We're actually moving in transition into the specialty care pod side of the clinic. But in between both primary and specialty clinic, we have 2 telehealth rooms for our providers to offer those services, as well as some independent workstations to get some of their work done. We're now on the south side of the clinic in the EMS hallway. We have the EMS bay right behind me, as well as to my left is the EMS living quarters, if you will. They actually have 2 beds, 2 very comfortable lounge chairs, and a refrigerator with a microwave. So come visit them. It's a nice place to hang out. We're fortunate to have EMS here on site 24 hours a day to serve and provide EMS services to North Valley right here in Stevensville.
We're now in the specialty care pod, which looks exactly the same as our primary and urgent care pod. Our exam rooms and our procedure room are surrounding the care team. We have our huddle station here for our staff huddles. And this is our vital sign room here. We can get the patient's height and weight. We have our vital signs on both sides. So specialty care pod has their vital sign area as well as primary and urgent care. We also have a privacy curtain here as needed.
So of the 20 exam rooms, we do have one that was built to be especially large for procedures. So I guess we can call it our procedure room. We are going to have specialists coming up to visiting this clinic, especially urology, OB/GYN, along with orthopedics. And so having the extra space will allow additional procedures and the amount of equipment that has to be staged in this area.
This is one of our 2 cart storage rooms with all of the materials right here located to stock the carts. It's right behind the care pod so that the clinic staff don't have to go very far to restock all of their specialty carts. Right behind it is our med room, again centrally located so that staff don't have to go very far to grab the meds for their patients.
Now in the lab area, we have some amazing testing equipment and team here to provide services to our clients. And a lot of the services actually get processed here in the lab in Stevensville, and if they're more complex, they can be sent via courier to the main hospital in Hamilton or up to Missoula. So we've got a great service here for our clients. I want to point out in this awesome space and this amazing equipment is our team and the skylight. Come visit them, it's never a dull moment.
We have patient financial services based here in Stevensville, so if any patients have questions about their bills or any ability to pay, they can come here and ask our patient financial services. They can also pay their bills here too.
Okay, so we have finished the tour of the south half of the clinic, which is primary urgent care and specialty care services along with imaging and lab. We're now going to move into the north half of the clinic space, and that is rehabilitation services along with our conference room and staff lounge. So let's go take a look. We're excited to offer physical therapy, occupational therapy, and speech therapy to our clients here in Bitter Valley. And we actually have a pool along with an outdoor exercise area with the views of St. Mary's Peak and the Bitterroot. So we're pretty lucky up here. The pool expands our ability to treat a wide range of patients with various abilities. We have an underwater treadmill, a massage wand, along with current for resistive exercises. Beautiful thing about aquatic therapy and rehab is that the water temperature is warm, typically 94, 95 degrees. Okay, so that concludes our tour of Bitterroot Health Stevensville Clinic. We do want to say a special thanks to several individuals, particularly the hospital board, our CEO John Bishop, and the administration and leadership at Bitterroot Health for backing this project and making it happen. And just as important, all the boots on the ground. The past few weeks have been amazing with materials, bringing all 7 moving trucks here to get all the equipment in, to maintenance every day showing up and helping us put the stuff together, rehab, imaging, lab, the clinic staff. Everybody was cleaning, moving stuff in, and it was awesome. So thank you, Bitterroot Health, for everything that you've done to make this clinic what it is.
Again, thank you to everybody who helped chip in and make this clinic ready for our patients here in our community. We'd be happy to give you a tour anytime. Please stop by.